Hey everybody, Doug Bailey, Plasma Rich. I've got a video coming up in just a few seconds, but I got a favor to ask. If you feel so inclined, please subscribe. And while you're at it, click the little bell so you're notified of all the videos coming up in the future. I'll have one a week, and you'll love them. They'll be empowering, they'll make you feel good, and they'll make a difference in your life. So come join me on my channel, Plasma Rich. Thank you.
Hi everybody, Doug Bailey, Plasma Rich. Hope you're having a great day. I'm sitting with Dr. James Denito today, and he has a private practice in the Allen, Texas area for the last 40 years. 10,000 people have passed through his doors with offering services such as chiropractic and lifestyle consulting services. He is nationally known. He also has tentacles out internationally. As a matter of fact, you could probably thank him for supporting and guiding two great Olympic gold medalists, Nastia Lukin and Carly Patterson. We are grateful to have him with us here today. He is the co-founder and manager of the Center for Cellular Regeneration. Welcome, Dr. Denito. Thank you for being with us.
Great to be here on your show, your channel, and we're ourselves are trying to get the word out, and this is just a great vehicle for me to be on here. We've been doing some radio and other television spots, but this is my favorite venue here when we get into a little more intimate setting, so I'm here to help out with any information you need.
Thank you very much. I want to start by, in the spirit of full disclosure, that you and I have known each other for 25 years, maybe more, I don't know. And you have helped me. You've been instrumental in helping me and my family get healthy, stay healthy with your advice in nutrition, in supplements, in the chiropractic adjustments, all sorts of levels that you've helped me on. So the reason I bring that up is my subscribers know that I'm really big on health. And I want them to know it just doesn't come out of thin air. It comes from experts like you. So thank you very much for helping me and my family.
Okay, you're welcome.
We are talking today about stem cell, and I feel strongly that this was meant to be because I've heard you talk, I've heard some of the things you've suggested and advice you've given us on stem cell in the past. There are a lot of people out there that have questions about stem cell, and you can go to the internet, you can go to doctors, you can go to all sorts of levels of doctors and get different answers. So perhaps you can shed some light. You have some experience. What is your thoughts on for someone who's interested in stem cell, how would they go about doing it, and what would you say to the average person that is looking at that as a possibility for regenerating tissue?
I would say that I would never want to start with stem cells first, because you want to make the body receptive and worthy of what those cells are going to do to you. And the reason your stem cells have declined so much and you're thinking about this regenerative medicine is because you have not taken care of the terrain. There's toxicities, there's deficiencies, there's imbalances of everything from emotions to neurological supply. So what we try and do is see how far we can take people. And if we get them so far and we get stuck, we want to use that as a regenerative tool, bring them over the finish line. But we have some people where nothing seems to work and we just need a complete reboot, go back to the gene pool, and let's start over again, and the stem cells offer that opportunity.
Well, let's go back to that for just a second. So how do you, like, when you say that you don't look at that first, what kind of things can you do to help someone get to the point where they might be able to feel better about themselves?
The hardest part is getting them motivated, and that's getting into the psyche, and that's one of the reasons we decline so much in our health. There's a horrible sense of despair, loss of purpose to the human race right now. We're overwhelmed. We're all in survival mode instead of thrive mode. So the starting point, I try and give them some optimism and focus as to why they want to do any of this stuff, because many of the things to be healthy are simple, frankly, and they become habits once you become accustomed to the rituals of doing something, whether it be getting more sleep or just learning to drink more water or how to properly stretch,
right,
or your food selection, things of that nature. Then we can give people guidance and customize it to each person. We always will put chiropractic into the equation. It could be 5% of their journey, and it might be 80 to 90% of it, but it'll always be part of it. So we'll incorporate that, certainly, and then while they're here, I can give them advice and guidance mostly to make decisions on their own about other therapies, and might even be recommending that they go to the stem cell mechanism. But I also can help them with diagnostic is a challenging word sometimes, because when we take your blood and we want to see, hey, you're low in a certain nutrient, did we diagnose a vitamin deficiency? Is that a disease? Because the word diagnosis is always associated with diseases. But this is where we're at. We have to tell people what's wrong, and we often are finding, what are you low in? What is necessary to regenerate? And then what's got to go? Is it a virus? How can this nutrient or this change in your lifestyle get the virus to be vanquished from the system? Do you have too much mercury in your body? Do you have a parasite? Our COVID-19 epic battle that the world is facing right now, as we learn about this infection, we're learning that drugs that are anti-parasitical are working better than any antiviral drug did. And now we're understanding why that happens on there. But it's a simple equation that's got to go, and so what can we put more of in? And so we don't need more drugs, we need more of something more foundational, and we're finding vitamin D still plays one of the key roles in helping people vanquish a virus by now dozens of mechanisms of how it works on there. So we try and figure out what's going on with people, and then customize it to each person.
Right. So once we get past the point of we've got somebody healthy, they're taking the right things, they've done everything they can at this point, stem cell is a possibility for someone.
Absolutely.
And so you've had some experience with your patients over the years, and I don't know how long that's been, but you've been involved with stem cell to some extent for a number of years now. What do you see as some of the benefits, the pros, the cons, that stem cell can offer someone?
Our journey with stem cells, for me, is probably more than a decade old.
All right.
Because we started learning about platelet-rich plasma, something that was in your blood. Came across a book many years ago, Your Own Perfect Medicine, and it was saying, hey, things are in the urine that was free. You could then pull that back, find those messengers, peptides they were specifically called, put them back in your body, and they would stimulate mechanisms. The famous cancer protocol in Houston from Dr. Brzezinski started that way, and they found things that were basically waste products, but put back in a different compartment, stimulated your immune system. So,
and that works.
And that worked.
To
Our
some extent, right?
From looking at urine to platelet-rich plasma, then we did prolotherapy. We brought in a medical team, and that was made from your blood, and we would inject that in a knee or into a spine, and that would stimulate regeneration. Because chiropractic and nutrition and lifestyle changes, they can drastically slow the aging process, mend and repair things, but to stimulate complete reversal, put time back on your genetic clock, that's a different story. And that's why, as we started to see the stem cell industry grow, began with nefarious beginnings of the embryonic concept of using fetuses, and now we have this clean, wonderful source using donors of umbilical, periumbilical tissue, and it's a wonderful gift that would have been medical waste. So it's a very sophisticated system right now, very underneath the scrutiny of the FDA, and thousands, probably 6,000 clinics right now, including hospitals, are offering the stem cell protocol. So we've seen the cost come way down, where it's certainly well under $10,000, often even a third of that price for just some localized regions. And it used to be 10 times that amount when people were going out of the country, doing desperate, searches for things. So the protocol is very simple, frankly. It's a choice of volume. Do I want this much stem cells or that many stem cells? And
how do you determine that?
We make suggestions based on others had, hey, I did good with 2 cc's, I did good with 1, or they put it here, they put it there. So when they come in for therapy at any stem cell center, there's a medical decision-making process. There's a medical team, and from medical doctors to nurse practitioners, physician assistants, and the decision-making for where and how much is still ultimately done in that group, with the patient in the middle of that decision-making on there. So we just have a hands-off. Ours is more to guide people to what that system is going to do for them beyond what we've been able to accomplish any other way.
I've seen I've talked to a lot of people about stem cell, and stem cell is really close to my heart because just like you, I'd say before it even came to the United States, I was watching this and thinking this has got to be the answer to some extent to help people, just fix things in their body that can't be done otherwise, other than maybe surgery. And I've always tried to avoid surgery, and I think that's something that you've promoted too. Obviously, sometimes you have to have surgery. But what have you seen, like in my case, I've seen a lot of different opportunities for people to I've seen these situations where people walk away with stem cell and have complete recovery on some type of joint or some other parts of their body. You've had some experiences, successes with people some of your patients. Tell me about what you know that kind of sticks out for you that you wouldn't even expect, let's say.
Where we start is mostly orthopedics, since the chiropractic profession works with the muscular, skeletal, and nerve system. And then we go neurological. So we have a lot of people where a bone-on-bone situation existed and the stem cells put in locally and or systemically stimulated cartilage regeneration, new spacing, x-rays proving that the joint is reversing the process. If we go neurological, we've had stories of people where they had Parkinsonism, a deterioration, an inflammatory process in the brain. And the stem cells, after they kick in, distribute to the system, and stimulate genetic repair, the person may have a tremendous clinical response where other, even cognitive functions are improving. Then the question is, how long is that warranty going to last? If you do nothing else except throw those stem cells in there, that person's going to need a reboosting type of process. And it could be 3 months to a year, but sooner or later that process will be evident that they need more stem cells. A more logical thing would be to say, is this brain lacking any vitamins, fatty acids, minerals?
Right.
Is there any kind of degenerative toxin that's in there that we could be helping out? And so that's where the diet and lifestyle factors come in. So you get a better receptive body, you get a warranty, so to speak, that'll make it last.
So, the thing that I like about what you're saying is that you've got surgery that runs you $25,000 to $50,000. You got stem cell that, correct me if I'm wrong, but you're looking at $5,000 to $10,000 or something of that nature. But if you can go in and take care of the body for a couple $100 or $1,000, which it's hard for some people because it's a lifestyle change, because that's one of the things you're really good about is saying, look, you got to make a lifestyle change. It's just hard to communicate that to a patient, I would assume. Sometimes, not always. But so what you're saying makes a lot of sense. And I guess, so since I'm just so caught up in stem cell, I really love stem cell. I just want to know if you have any insight to, well, I'll use my daughter as an example. She has scoliosis. And I've read up on the internet, and you're going to get the pros, you're going to get the cons. And I've tried to figure out if that's something we can do, because there is opportunity for her to do that. There is a chance for her to, and I got to travel somewhere to do it, but I don't know if that's going to work or not. First question is, do you think, any thoughts to that? And the second question is, when do you use systemic and when do you do localized? Meaning, when do you have an injection for the whole body, and then so that my subscribers know?
Well, other than
put it in
in the setting where most stem cell centers outside of a hospital are, the localized things are just orthopedic stuff, on this region of a knuckle to your knee. But if you want to get eyeballs, livers, spleens, that's much more of a medical, almost surgical procedure.
Okay.
We had a patient with ALS, and they opened up his spine and implanted them in there to buy him some more time on that. So sometimes that's a process where you do want to try and get as targeted as possible. And that's where the people who are advocates of just all intravenous, you don't need to target. They go in, and they're going to be going to predictable regions first as the lymphatic system, the immune system essentially collects them. But they're attracted to sites of inflammation, infection, injury, malignancies, and they're going to have like an immune function first of what can I do to help out here. So that decision making is built into the genes. It's an algorithm, the same as how a literal ball of cells becomes a complex human. There's a sequence of geometrical and chemical changes all built in. So essentially the stem cell just comes in with a fresh genetic library and plops itself into a region, that will then say, all right, you guys are supposed to be duplicating, you're dying off, you replace that one. But when we don't have a good enough gene pool in an area and that has degraded, the stem cell will become one of those cells around it and have a perfect genetic copy of how that liver cell is supposed to work, let's say, and can start making more perfect liver cells, and eventually all the decayed genetic material around it will be shed, and it's how you rejuvenate. So why stem cells decline, that's the big question. We understand the wear and tear on the body, and but a stem cell, if it's so perfect and it doesn't have anything to do, doesn't have to do any specific job, it's just in there doing what a cell does, living, breathing, and then make a few copies of itself periodically. Why does the stem cell population decline? And it's obviously that it's as vulnerable as the rest of the cells are to the environmental stressors on it. It needs nutrition, it has waste products of its own, and so it's like any cell, it declines with them, except the stem cell is very precious in how many of itself it can make, it seems. And so the cells around it may duplicate themselves thousands of times over your lifespan, but a stem cell has more of a limited ability, it seems, to regenerate itself. So what we're basically doing is saying, let's let most of these just go in the blood and let the distribution process work on its own, instead of trying to sweat the details and overthink this, because modern medicine tends to do that a lot. They want to be mechanistic, reductionistic. The body's very machine-like, so let's go in and fix those little parts. And natural healing has never been that way. It understands the program of vitalism, and the system knows how to do it. We just got to find the right places to start that mechanism. A single match can burn an entire forest down, but there's a lot of details about what fire does and how it spreads. We don't have to think about that. You just put the match down and you step back. So the stem cells are like that. They're a powerful trigger, and then we let them do their magic from there.
So a final note, if you had a patient that came to you and said, you know, I'm thinking about surgery, but I also have I'm looking at stem cell, and you looked at them and you said either one would work. Obviously, we try to avoid surgery when we can. How would you approach that? I mean, obviously, if they take stem cell, there's a possibility that may not take, right? There has been cases, very few that I know of in my little journey of research, that have not accepted or worked with them. But for the most part, it seems like it does work. You're talking about spending, say, $5,000. I just throw out a figure, $7,000 on stem cells. Is that about right?
Yeah.
So you're doing $7,000 on stem cell, and your surgery is going to tie you up for 6 months to a year. That's another question, is that stem cell seems to start taking effect several weeks or months later. Is that correct? So I got two questions in there. How long does it take, and how would you handle a patient that would be coming to you with a dilemma of surgery versus stem cell?
When I have to finally recommend surgery for someone, usually
it's
they
the
need
last
surgery.
resort.
Yeah. And when we do, and we've done so many other things, that surgery is always a great success.
Right.
We find the right surgeons, of course, and we give them a little extra menu of nutrients to take along. And we've had many people say their surgeons were amazed. They never saw anybody heal that fast. And that's just cultivating what the body's supposed to do right now. We have a cancer case that we've been advising nutrition on, and when they started the chemo, when we said, you're losing the battle, you've been winning as much as possible, but it's time to incorporate much more of the medical system. And when she started the chemo, this tumor of hers shrank in 6 days as much as normally would take 6 weeks or so. And the doctors at MD Anderson have never seen anything like that, because they're not used to people having nutrition and the whole
Right.
body and health. People come to them and they're victims of cancer, and they haven't done anything to change why they got cancer. They just tell those doctors, cut it out. So if you can do all these things first and get your body ready for battle, then it goes in. So the surgery option is definitely a last one, and we'll tell people a $20,000, $30,000 surgery anywhere orthopedically is a common thing. So let's spend $5,000, $6,000 or so, get that done somewhere, and we'll probably avoid the surgery. But you're going to have to wait a few months for the results to take. If you think about a little ball of cells becoming that complex human, we break that 9 months into trimesters. In the first trimester, you have pretty much all the parts organized into a viable, definable living thing. The next trimester is where everything matures and fortifies and is survivable to come out before you fine-tune and make yourself, let's say, more durable to anything. But this is where we start looking at stem cells. If cells are coming into a joint or an organ, they're going to need 2 or 3 months to build the architecture up before it starts becoming survivable. So we tell them they're going to have to go a little bit easy on lifestyle and still be delicate to their body. If they're a big alcohol drinker, you say, don't poison your body with these young stem cells in there. That's how you got to the point where you need the stem cells in the first place. So we have to be patient with them. We're telling our patients who come to, whether they're at the stem cell center that we are part of or others, we're gonna get a call and we're gonna be checking every 30 days, but we're not expecting much for a month or two. But the fact is, there is a nice mixture of responses already in the first 30 days. And my response was that here I am 6 weeks since my stem cell experience, and I'm already getting some clarity and sight restoration to my left eye, which was blinded when I was 1 year old from a vaccination that didn't go well. And so I've lived my whole life essentially legally blind in one side. So I know what I can see and can't see out of this eye, and I've had some of the best eye doctors in the world looking at me. But in the last couple of weeks, I can see reds, I can see my fingers out here, and they weren't put in my eyeball, they were put in my arm, but they found a way up to there. So they say that for most people, when they start surveying responses over, hey, how'd you do in the last year, they're finding that people who had goals and they were able to subjectively say, this is what I noticed, there's about 80% response rate. So that means you have an 80% chance to get something beneficial that makes you happy you did the stem cells. But if it's 20% non-responsive, or is that just maybe something happened that you're not aware of? Maybe an artery opened up in your heart and you don't even know it because that's hard to measure. And maybe your immune system is stronger and more durable and you won't get this virus or anything close to it because your immunity has been boosted up. So it's not always easy to be subjective about something and be objective at the same time. But we're excited that we can tell people for everything from this scoliosis instance here, Dan, that's a tough target. There's a lot of things involved in scoliosis. There's orthopedics, there's neurologics. They even found that people were low in zinc, and that zinc as one mineral out of 70 or so in your body can make a dramatic difference in slowing down scoliosis. And we might speculate how it involves itself in collagen and connective tissue, or maybe how the brain left and right hemispheres even work. So if I had to guess, what would I do for a scoliosis person? Familiarity with your family, I'm not sure I would know where to start on that, except I would make sure that I got everything else in place first. I would analyze the nutrition and look for everything to be balanced as much as possible. And then we would go to some people who are much more versed in that, and they would say, oh yeah, when we get that, we'll use this muscle here and that joint there and put some in, and they stimulate some regeneration and the body starts to unkink. And maybe it's more complex than that, and it involves just sitting in the vein and saying, body's going to figure it out. We're not going to sweat the details on that one either on here. So I think the sky's the limit as far as how many things could be amenable to stem cells. But we also look at, would we give a 20-year-old stem cells? It's highly unlikely that they would need that unless they have some real tough genetic thing, and we're trying to literally repair that and maybe undo genetics even. Or maybe there was such a traumatic experience, maybe they had a horrible meningitis and the brain membranes were damaged, but they're 20 years old, but it left residuals. It's possible that no matter how many stem cells that person still has, it would love to have twice as many for a few weeks to repair that in there, and it might even help that. But generally, we think the older you get, the more you're going to benefit because you have less and less of your own. And so it's a numbers game.
I want to thank you for coming in, letting us come into your office today and spending a little bit of time with you. You probably don't know how much you've affected some of the people that are listening to this video at this time. And if you would, tell us how, I'm sure there's some that might want to get a hold of you. What's the best way to reach out to you?
Okay, we have a number of different avenues we're helping people. The main one would be denitochiropractic.com.
DENITO. Okay.
chiropractic.com. And from there, we have access to the ozone and the stem cells, and other links will be on there. And for those who are also curious, some of my other adventures, I'm heavily involved in some new technology, trying to save the world from the oil fracking dilemma that we all have. So we could talk about that on another show, because when you start figuring out alternative ways of doing things for human health, you begin to find things coming your way in other areas. And so we have a lot
Excellent.
of interesting topics.
We'd like to meet with you again, and thank you for joining us. I will put your information down in my description so my subscribers will look for that. Thanks again for joining us.